But you can put this money away out of your savings and put it away, and you say, well, that's great for families that can afford to put it away. What about the people that can't? And under the Republican plan, there's a means-tested, refundable tax credit that works sort of like the earned income tax credit, where it's redistributive. So even if you don't have enough money, you would get money that would go into this HSA, and then you would direct it towards the insurance premium so that you can help make insurance more affordable. So that's how it's designed to work.
My son did not have health insurance for 4 years until the ACA, when Medicaid was extended. He didn't have health insurance because he's in the service industry. And that industry pays minimum wage, and they keep their employees below a certain number of hours so that they don't have to pay health insurance. So many of the people that are on Medicaid are working, and they are the working poor. Under Trump Care, one of the major ways to make health insurance affordable is to bring back catastrophic insurance, which is basically no insurance at all, given that preventative health care is the #1 way to keep people healthy in our society. Can you explain why my son and millions of others in his situation are not deserving of affordable, decent health care that has essential benefits so that he can stay healthy and continue working?
Yay!
Okay, I don't know anything about your son, but as you described him, his skills are focused in an industry that doesn't have the kind of options that you want him to have for healthcare. So I don't believe that the taxpayers here are entitled to give that to him. I believe he's got the opportunity to go earn those health benefits. The majority of Americans earn their health benefits at work. They do. Nearly 200 million people do. There's only 11 to 30 on the most generous prospects. There's under 30 million people in the individual market. When President Obama launched his expansion program, in order to cover folks, as you described your son, who came into this category of Medicaid expansion, they said, we're going to reimburse you at 9-to-1. It provided a perverse incentive for states to grow that population. Well, what about prescribing what benefits he shall have? If he doesn't want a catastrophic care plan, then don't buy a catastrophic care plan. If you don't want a flip phone, don't buy a flip phone.
Oh my gosh, stop doing that.
I'm sorry, healthcare is much different than a cell phone, and I'm tired of people using cell phone analogies with healthcare.
You know, I think that most Americans accept some sort of social safety net, but I believe in a free market. And lots of people don't believe in a free market. They want healthcare as if it were an endowed by your creator to healthcare.
Yes, exactly.
And we weren't, but we weren't endowed by our creator with healthcare. We were not endowed. We were endowed with life. All right, and so you're not entitled to someone else's stuff. And so in healthcare, for example, I think we have to protect a free market.
Can I ask my question that has to do with a free market? Will you commit for your constituents tonight to working to ensure that we have a true, free, competitive market by ensuring that any revisions to the Affordable Care Act includes a government option that we, your constituents, can choose what we want?
No, I don't believe the federal government should operate a health insurance company. No, thank you.
But you believe in a free and open and competitive market.
I believe in a free and open competitive market for gasoline, but we don't have a federal gas station.
I need gasoline to live.
Not yet. But gas isn't the same as
We don't have a
healthcare.
federal car company. It didn't work out that way. I mean, no. We don't need to operate a federally
Well, in
funded.
a free and open
We don't have a federally funded-
competitive market, the free hand of the market would decide.
Okay. So